It's pretty universal. Now, supposedly someone did a study and said that women lose 20% of their libido, which I don't know how they put a number on it, but there's a drop because of the hormone drop. And then,
I'm surprised it's only 20%.
Yeah, that's what I mean.
Like so many women.
It seems to be higher because most women are, we're stress affected for our sex drive.
That's true, too.
But when we start getting the dried out vaginas that hurt, and women will describe it feeling like, glass. Sandpaper. Not very fun with intercourse and things like that. Then that's an issue too.
But that can be helped, by the way.
Right. There's a lot to do for that.
There is. It's great. That along with, to me, the bladder issue, which is that due to the low estrogen?
Yeah, so what women don't realize is the bladder sits right above the vagina. And so when we, like, let's say we gave a woman vaginal estrogen to help with the dryness, it also helps support her bladder tissue. It thickens the tissue in the vagina and the bladder. It makes it thicker and more pliable again, like it used to be. So that is a big deal. So low estrogen will make women sometimes have more leaking or more urgency or frequency of urination. And so,
like kind of what I had, that's why I love talking about that. The cream just makes me even have a stream, believe it or not.
Yeah, it makes a big difference.
Big difference
because it's thickening that the bladder tissue just as much as the vaginal tissue and making it function more normally again and be more protective. They also women who get a lot of frequent bladder infections, they did a big study in women who were pretty elderly, like in their 80s, who had frequent bladder infections. And when they used the vaginal estrogen, they found that they had like an 86% reduction in urinary tract infections. So super effective, right? And you don't think of that when you think of treatments.
That's right.
And also, there are different things you can use to treat the vagina. And the one thing I think that is tricky is that when I give women vaginal estrogen, the package insert, the warnings is they're the same warnings they give for the pills. But it's so different because when you're putting it vaginally, there's not a lot of systemic absorption into your bloodstream. So it's not the same risk factor. So, for example, we can safely use vaginal estrogen in women who have breast cancer. It's not your first choice.
I'm so glad you said that because there's women that our doctors will say, you know what, you already do this, you can't get the cream.
Right.
And you can't insert even into the vagina if you take a regular type of...
Oh, yeah. But even I have women, that's their only complaint. So why would I give her something systemic that has some risk factors when I could just treat her vagina and not give her any risk? It doesn't increase risk for uterine cancer. It doesn't increase risk for breast cancer. It's more of a local... Yeah, it's a local treatment, so it's very, very safe. Now, you have to take it the way it's directed. You can't just, if you put a tube of cream up there, you'll get a lot of absorption. So you have to take it as directed. And, but yeah, so I think that women are afraid to do it. Sometimes it's not the same as doing hormone replacement. And like you said, let's say you choose to do estrogen replacement, like I do a little estrogen patch. Well, sometimes it's not enough to give you vaginal benefit at all.
It didn't for me.
Right.
Nope.
So that's the thing. So some women will have to do both. They have to do both.
I do both.
Yeah. To keep things functioning. And some women never need anything. That's pretty rare, though. It's pretty rare.
So that's why you need a doctor that actually treats you individually.
Yeah.
It's so important.
Yes. And there are some newer products now for the vaginal dryness as well.